The term midwife or midwifery derives from Old English, mid meaning with and wif meaning woman. The term in its literal sense describes the person who comes to be with the mother during childbirth. From the beginning of humanity and through the millennia, the birthing of each human baby was usually helped by a midwife. The midwife was the mother's female relative, a friend, or the village experienced woman who knew about the process and understood on some level what to do if problems ensued. Up until the mid-1700s, midwives delivered most babies until some upper-class women started wanting physicians to be present for the delivery because of perceived safety issues. At the same time, most physicians were male and most midwives were female, creating a gender-based rivalry between female midwives and male physicians. And that conflict still persists. In 1900, about 50% of babies in the US were delivered by midwives, but by 1935, that number had dropped to about 15%. In the 70s, the feminist movement revived an interest in midwifery, which we see today. That trend may change, however, as now 70% of new OBGYN residents are women, compared to less than 50% just 10 years ago and much less before that. Pregnant mothers have many options from which to choose for help with their birthing experience. These include physicians, family physicians or obstetricians, certified nurse midwives, nurses with required specialty training and proof of competency, certified midwife, not a nurse but with special training and proof of competency, or lay midwives, someone who may or may not have had special training or experience. Her options for places of delivery now include a hospital, a birthing center, or a home birthing space. For our babies, my wife and I both elected to have our family physician do the deliveries in our local hospital. In this day and age, for the most part, babies will come out safely. But sometimes something can still go wrong, and this usually happens very fast. In the early 1900s, the death of the mother occurred in every 100 to 200 births, or 600 to 1,000 deaths per 100,000 births. Now that number is down to 15 deaths per 100,000 births. Because of the unforeseeable and sometimes catastrophic nature of birthing, until those 15 deaths are zero, I personally recommend having all births delivered by a highly trained and certified individual in a birthing center or a hospital.